Hello everyone, you are listening to Dr. Huma Ibrar, and this channel is all about international license exam guidance and material. So if you still haven't subscribed this channel, kindly subscribe this channel and don't forget to click the bell icon. Today I'm going to share past latest MCQs of OMSB exam, that is for Oman. So let's start the topic. There was a photo and the question was about what is this position called? Option A, half kneeling, option B, prone kneeling, option C, sitting kneeling, and option D is half standing. And there was a photo of half kneeling, so option A was correct. Moving towards second question, orthosis. Orthosis is a device that replaces the absent part of the body. Option B, person who fabricates prostheses. Option C, device that replaces the existing part of the body. Option D, company which fabricates the orthosis. So moving towards question 3, which muscle closes the mouth? A, masseter, B, lateral pterygoid, C, buccinator, and D, orbicularis oris. Number 4, arterial blood pressure means option A, difference between systole and diastole. Option B, pressure exerted on arterial wall. Option C, maximum blood comes from ventricles at the end of diastole. Option D, maximum blood comes from ventricles at the beginning of systole. Moving towards next question. Which of the following terms describes the stiffness of first metatarsopharyngeal joint? Option A, pes cavus, option B, hammered toe, option C, hallux rigidus, and option D is talipes equinovarus. Moving towards the next question. A 44-year-old man with knee disorder was referred to physical therapy clinic after examining the patient. The physical therapist's goals were to decrease the pain, increase the muscle strength, and increase the range of motion. Which of the following outcome components from the International Classification of Functioning (ICF) is the physical therapist aiming to improve? Option A, personal factors, option B, activity limitation, option C, physical impairment, and option D is participation restriction. Moving towards the next question. Power weightlifter is being evaluated by a physical therapist for pain in his knee joint. The therapist notes severe pain during grinding of patella and when climbing stair. Which of the following is the most appropriate description for this condition? Option A, jumper's knee. Option B, Perthes disease. Option C, chondromalacia. Option D, iliotibial band frictional syndrome. Moving towards next question. Which of the following is the additional caloric intake per day needed for an exercising pregnant patient? Option A, 300, option B, 400, option C, 500, and option D is 600. Moving towards next. Which of the following temperature ranges in Celsius is the melting point of wax for therapeutic purposes? Option A, 30 to 35. Option B, 40 to 45. Option C, 50 to 55. And option D is 60 to 65. Moving towards next. In which of the following axis and plane on human body flexion and extension motion will occur? Option A, around the sagittal axis and in the coronal plane. Option B, around the coronal axis and in the sagittal plane. Option C, around the coronal axis and in the coronal plane. Option D, around the longitudinal axis and in the transverse plane. Next question. 45-year-old woman, patient with hand problem. During the assessment, there is pain, numbness, and tingling in the hand and arm. So, which of the following nerve is most likely affected? Option A, ulnar nerve, option B, radial nerve, option C, median nerve, and option D is axillary nerve. Moving towards the next question. Which of the following is the most appropriate method of checking the shortwave diathermy machine before application? Option A, neon light. Option B, electric tester. Option C, warmth between electrodes. And option D, sparking between electrodes. Moving towards next. Which of the following scientific term is defined as the marked impairment of the production and comprehension of language? Option A is fluent aphasia, option B is global aphasia, and option C is non-fluent aphasia, option D transcortical aphasia. Moving towards the next question. Therapist starts physical examination of a patient who has neurological disorders. The therapist finds that the patient has both upper and lower limb weakness with breathing problems, which were exaggerated by the repetition of movements, and rest. Which of the following is the most likely diagnosis? Option A, myotonia. Option B, myopathies. Option C, myasthenia gravis. And option D is motor neuron disorders. Moving towards next question. A 32-year-old patient requires a physical therapy assessment to start the post-operative rehabilitation program. A surgeon performs partial osteotomy of the right shaft of femur to correct its alignment. Which of the following describes the procedure of osteotomy? Option A, internal fixation of bone. Option B, removal of periosteum. Option C, operative sectioning of a bone. Option D, surgical closure of an epiphysis. Dystonia definition, that is involuntary movement characterized by twisting and repetitive movement. So again there was definition about bradykinesia, slowness of the movement, hallux rigidus, stiffness of the first interphalangeal joint, protraction and retraction of a shoulder occurs at option A, glenohumeral joint, option B, scapulothoracic joint, option C, acromioclavicular joint. Again the next question. The terrible triad is a tearing of the medial collateral ligament, the medial meniscus and the anterior cruciate ligament at the same time. Moving towards the next question. Which current is used for stimulating denervated muscles? Option A, TENS, option B, Faraday current, option C, dynamic, and option D, direct galvanic. That is correct option. Patient has CVA and middle cerebral artery affected. Which part will have the best complete recovery? Option A, shoulder, option B, elbow, option C, hand, and option D is hip. That is correct. The best coupling media of ultrasonic, which of the following? Option A, aquatic gel, option B, glycerol, option C, liquid paraffin, and option D is cryogel. The correct option is aquatic gel. Next question. Colles fracture occurs at option A, distal 1/3 of the radius, option B, proximal 1/3 of the radius, option C, distal 1/3 of the ulna. So the correct option. So that's it for today. Thank you for watching this video. Subscribe my channel and stay connected for more videos.